My name is Susie Moscou. I am a nurse practitioner at Care for the Homeless. I have both a family nurse practitioner and a psych mental health nurse practitioner. Okay, so the site that I have worked for many, many years is here, Jerome Avenue Men's Shelter. But I've also worked in many, many other shelters. Basically, I service people who have obviously been homeless or undomiciled for various reasons. Okay, obviously a lot of them have mental health disorders that make it difficult for them to remain in housing without some type of supportive services. And they don't see, people who have substance use problems, people who have schizophrenia, people who have bipolar, probably severe depression or severe anxiety, which then somehow brings them to the shelter system. We have to understand that what in our environment can contribute to people having mental health disorders. And it's not easy to live in a society where we don't have social safety nets that could actually make people feel safe, make people feel secure. There's no reason that people have to grow up in neighborhoods that are violent. There's no reason that people have to live on the streets because there's not enough housing. So I grew up being an activist for civil rights, women's rights, all kinds of political and social rights. When I went to Yale University to become a family nurse practitioner, I applied for the Natural Health Service Corps, which if they funded you, you were required to work in what they call a health professional shortage area or a medically underserved community. I've always worked in communities that were either medically underserved or, let's say, economically under-resourced. It continues my social commitment to how I think the world should be a better place, and that healthcare is a right for all people. It's not just for people who have money. And it kind of is problematic that in the United States, we really don't believe that it's a universal right that everybody should have. And considering we are one of the richest developed nations in the country, that we still do not have a system that everyone can access. So I was inducted into the School of Nursing and Midwifery, which is at the Royal College of Surgeons in Ireland. And what was wonderful about this fellowship is I didn't need to be nominated. I could nominate myself. And it was a lot of work. But what I loved about it is a very self-reflective process about who I am. I was accepted and I went to my induction in Dublin, Ireland on December 9th, and it was so much fun. And what I'm hoping to do is now make an international connection between some of the research that I'm interested in and obviously teaching philosophies and so on. So, Care for the Homeless's mission is to provide care to people who either lack services, okay, or even people who have insurance, all right? And so that mission has not changed. Even if everybody had universal health care, Care for the Homeless has clinics that people can go to. So they should never go away. They should always be away. The only thing that should go away is that the people are undomiciled. Or if they are, it's just for a short period of time. This institution, Care for the Homeless, has been there. And so that's why I think Care for the Homeless should continue, just hopefully without the homeless part, just health care for people or something.